Pranayam is an integral part of the 8 limbs of yoga and is considered a powerful breathing technique essential for achieving a state of inner calm and meditation. Pran is the vital life force energy which is keeping us alive. It is the awareness and consciousness of the mind. This force is a combination of 5 prans located in various locations of our body. Apan pran is related to the energy derived from organs below the navel. These organs are required for elimination of waste and reproduction. This is related to the Mooladhara chakra and Swadhisthana chakra. Saman pran energy derived from organs above the navel and below the heart. These are the liver, stomach, gallbladder, pancreas, small and large intestines. They help in digestion, metabolism, and blood formation, which help in energy production and are related to the Manipur chakra. Pran derived from organs within the chest and related to the Anahat chakra. They are the lungs and heart. It is responsible for oxygen intake from air and spreading it to the rest of the body. Udan pran is located between the larynx, that is the Vishuddhi chakra, and the skull, the Sahasrara chakra. It includes the brain and all special sensory organs required for smell, vision, hearing, taste, and touch from the upper and lower limbs. Vyan pran pervades the whole body and controls all the prans, and it is by which cosmic energy communicates with the body. Amongst the Mukhya prans, it is the pran which is responsible for breathing and respiration, which we can voluntarily control. Normally, respiration is a passive process taking place involuntarily. We can alter our respiratory pattern to make it an active process by taking control of our respiration and activate the other prans to make a healthier body. The consciously controlled breathing exercises are believed to bring balance and harmony to the body, mind, and spirit by regulating the flow of prana or life force energy. The above diagram depicts how our soul or bliss body, the Anandmaya Kosh, is surrounded by various sheaths, the outermost layer being our physical body or the Annamaya Kosh. The aim of pranayama is to increase the energy level in the Annamaya Kosh, that is the physical body, and raise it to the Pranamaya Kosh, energy body, where it is distributed in the body by way of nadis and chakras. Subsequently, the level is raised by the intensive pranayam to other koshas, namely Manamaya Kosh, the mental body, Vignamaya Kosh, the wisdom body, and finally the Anandmaya Kosh, the bliss body. Yogic breathing or lamba, ghera, shwas is the fundamental pranayam on which other pranayams are described and should be understood first. When doing pranayama, one should close the eyes and sit in any comfortable position, provided the spine and neck are kept erect. Yogic breathing refers to a systematic method of controlling the breath to optimize oxygen intake, calm the mind, and balance energy flows. It typically involves 3 stages: abdominal breathing, which focuses on diaphragmatic breathing to use the lower lungs fully; thoracic breathing expands the rib cage and engages the middle lungs; and clavicular breathing draws breath into the uppermost part of the lungs. Full yogic breath combines these stages, starting from the abdomen, moving to the chest, and finally lifting the collarbones, ensuring a complete and deep breath. To understand yogic breathing, first observe the abdominal or diaphragmatic breathing. Lie down in supine position with palms of both hands on the belly and start breathing deeply. You will feel that the belly moves up during inhalation and falls during exhalation. Inhale, exhale. Note the belly rises during inhalation and falls during the exhalation. Now, practice diaphragmatic breathing in the sitting position or in any comfortable asana. Observe that the belly moves out during inhalation and it moves in during the exhalation. During exhalation, try to move your navel as close to the spine. Observe diaphragmatic breathing in Vajrasana. Inhale, exhale. Inhale, exhale. Now perform a yogic breath by merging the abdominal breathing with the thoracic and clavicular breathing. After maximal contraction of the abdominal muscles to bring the navel as close to the spine during the exhalation, release the abdominal contraction and start inhaling deeply so that the belly moves out, followed by expansion of the chest, and finally lifting of the collarbones and shoulders. During the exhalation, the shoulders will move down, the chest retracts, and the abdomen moves inwards. At the end of exhalation, keep compressing the navel towards the spine for some time before the next inhalation. This will constitute one yogic breath.
पेट फूला, अपर चेस्ट तक जाकर कंधे पीछे चले जाते हैं. निकालेंगे बाहर, कंधे वापस आए, चेस्ट कंट्रैक्ट हुई, पेट कंट्रैक्ट हुआ. एक एक अंग पर पूरा फोकस, पूरा सही टेक्निक थी. 5 की गिनती में पेट पिचकाया, फिर से भरेंगे सांस. 5 की गिनती में पेट में भरा, निचली छाती ऊपरी छाती पर पहुंचते ही कंधे पीछे चले गए, छाती फैल गई. एक्सहेल विद द काउंट ऑफ 5, कंधे वापस आ गए, छाती सिकुड़ने लगी है, कंट्रैक्ट हो रही है. एब्डोमिनल मसल्स आर कंट्रैक्टिंग टू द काउंट ऑफ 5 while we are exhaling.
Now modify this yogic breath with slow inhalation and a still slower exhalation. The exhalation should be twice the inhalation. If inhalation lasts for 5 seconds, then exhalation should be for 10 seconds. This helps to decrease the breath rate per minute and also to increase parasympathetic activity. This ratio can be adjusted according to one's capacity. Inhale 1, 2, 3, 4, 5. Exhale 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Finally, practice holding the breath briefly after inhalation and exhalation, and again between exhalation and inhalation. Hold after inhalation and give a pause after exhalation. This will lead to the ideal yogic breath, which comprises of 4 phases. First, a deep inhalation Second, momentarily hold with focus on Agya Chakra. Third, slower exhalation with focus on compressing the navel. Fourth, slight pause after contraction of the pelvic floor muscles, that is, application of Mool Bandh. Mool Bandh is recommended during the hold and pause period. However, patients with heart or lung problems should avoid it. Observe the 4 stages described in the above video. First, a deep inhalation. Second, hold and Mool Bandh with focus on Agya Chakra. Third, slower exhalation with focus on compressing the navel. Fourth, pause with contraction of the pelvic floor muscles and application of Mool Bandh. Observe the 4 stages of yogic breathing again. Relax abdomen before next inhalation. While performing yogic breathing, all our 5 prans get activated in a sequential order from below upwards. Pause after exhalation with contraction of the pelvic muscles, that is Mool Bandh, activates our Apan Pran, thus activating the Mooladhara and Swadhisthana chakra. Movement of the diaphragm downwards while inhaling massages the abdominal organs and activates our Saman Pran and Manipur chakra. Movement of the thoracic cage during inhalation, that is thoracic breathing, activates our Mukhya Pran and Anahat chakra. The movement of the upper thoracic or clavicular breathing activates the Udan Pran, that is the 5 senses and the brain. Vishuddhi and Agya chakra are activated. The Vyan Pran gets activated when all our prans are active, resulting in activating our koshas, that is the body, mind and soul. In a single inhalation, you can see that the chakras are also getting aligned, starting with Mooladhara chakra, Swadhisthana chakra, Manipur chakra, Anahat chakra, Vishuddhi chakra, Agya chakra, and the Sahasrara chakra. Benefits of yogic breathing are numerous and are being attributed to be due to the stimulation of the parasympathetic component of the vagus nerve. Pranayama stimulates digestion and excretion activities, improves lung capacity, thereby oxygenation, improves cognitive function and memory. Increased oxygen intake boosts energy levels and vitality, improves blood circulation, stabilizes blood pressure and heart rate, increases heart rate variability by increasing the vagal tone, regulates the sleep-wake cycles, promoting better sleep and quality, controls anger and insomnia, decreases stress and anxiety by decreasing cortisol levels. Lastly, it aligns all the chakras and leads the path towards meditation by connecting the mind and body. Dhanyavad.